Good afternoon, ladies and gentlemen. It's my pleasure to interview Senior Gastroenterologist, Consultant, and Hepatologist Dr. Rajiv in Ludhiana
Thank
City,
you.
Punjab.
Thank you, Rajit. Thank
So,
you.
sir, today it's my honor to sit beside you and talk about FibroTouch liver scan machine. I'm sure that to all our viewers, you'll be able to tell your experience of using this machine for last 5 years. So, firstly, I would like to know that this particular machine is getting aware day by day. There were serological tests, ultrasound, liver biopsy. So, why there was a need of such non-invasive technology shear wave in Indian market?
Rachit, I think it is a very valid question. Initially, gold standard was biopsy, but now because of risk of biopsy, because it is a painful, it is a costly, patient needs admission, and there is a risk of complication also, even bleed and mortality. So even now the international guidelines like EASL, they say that liver biopsy is not required. Apart from small subset of patients. Apart from LFT, we have certain scores. They are very important, but again, they are very costly. So if you talk about score, apart from LFT, we have APRI score as well as FIB4 score. But this machine, it is a very easily available, can be used in OPD. So I'll term this machine, this technology as a stethoscope of a hepatologist. It is easily available in the OPD and it is easily producible. It is objective evidence is there and can be done routine and day-to-day practice.
So, sir, as you know that NASH and FLD are becoming global pandemic. So, why existing technologies could not support consultants and FibroScan got a mandatory test there?
The question is there is certain limitation of liver biopsy also. Number one, the sample size in liver biopsy, there is a variation when you took 1 core, 2 core, 3 core. Sample size is very small, so there is a variation in the sample size. Here in FibroScan, we are scanning an area which is 100 times more that of biopsy. So that is very important. So we are able to change that position. So whole liver can be scanned with this machine. And regarding blood tests, they're very costly. They're applicable in Western population, but not in Indian population. We need one test which is very, very reliable, which is objective, can be used in day-to-day practice, painless, without any admission. So probably this technology, transit elastography, has been validated by different societies as a good test, which can test the stage of the liver disease.
So, like yesterday, I was hearing few consultants talking about NASH in type 2 diabetes and why endocrinologists and diabetologists should also use this technology. So, have you ever heard or seen any data or gone through some patients who are having type 2 diabetes and also having chronic liver diseases?
Actually, that is very, very valid point. Now, what the data says, 70 to 80% of patients of diabetes mellitus, they are eventually having fatty liver. And apart from that, around about 10% they are having F4, that is their pre-cirrhotic, and around about 25% patient of early fibrosis. So for endocrinologist proper and physician perspective, we should have this technology with us to verify what is the stage of liver that will help us to detect and plan accordingly, because in fatty liver it is now NFL is a major chunk. These patients, they are becoming cirrhosis. So if you talk about Punjab, in Punjab, because of alcohol and hepatitis C is going down and down. NASH CLD is coming in a big way. So all patients who are either having diabetes or obesity or even lean NASH. So if you are having fatty liver, this with this technology we need to have that proper assessment of fibrosis as well as steatosis.
So, sir, like you have clearly spoken about NASH, NAFLD, ALD, and CLD. I also hear a lot of patients who are having long-term medication, like a patient having epilepsy and taking various medication for 10 years. Do you think such medication impact on liver and their patient's liver scan should be there?
If you talk about per se other causes apart from hepatitis C, alcohol, and NFL, there are many causes. One, it can be simple autoimmune hepatitis. It can be drug related. There are certain rare causes also. That is storage disease also. Anywhere, if there is a fatty liver, we have to use this technology, whatever is the reason behind that fatty liver.
My next question for the viewers is that how do you monitor NAFLD and fatty liver patients in day-to-day operations of OPD through this machine?
दिस इज वेरी वेरी वैलिड क्वेश्चन. अगर एक पेशेंट को फैटी लिवर हो जाता है, उसका हम इलास्टोग्राफी कर ली, पेशेंट का आ गया कि आपका ये स्कोर है. नंबर वन, इट विल हेल्प अस टू गिव द ट्रीटमेंट. पहले हम पेशेंट को कहते हैं आप डाइट अच्छी करो, आप वेट लॉस करो अपना. अगर पेशेंट 10% वेट लॉस कर लेता है, देयर इज सिग्निफिकेंट इंप्रूवमेंट इन स्टेटोसिस. बट जिन पेशेंट में वो नहीं हो पाता, देन वी नीड टू ऐड सर्टेन मेडिकेशन. अगर पेशेंट हेपेटाइटिस बी है, सी है, उनका ट्रीटमेंट करना है. एनएफएलडी में कुछ मेडिसिन आगे वो दे सकते हैं. और इन पेशेंट को हमें रेगुलर फॉलोअप करना पड़ता है, नॉट विद ओनली एलएफटी, लिवर फंक्शन टेस्ट. सो इन पेशेंट का सीरियसली हम फाइब्रोसिस भी देखते हैं. मे बी आफ्टर 1 ईयर व्हाट इज द रिस्पॉन्स. जितनी भी न्यूअर मेडिकेशन आई उसमें हम देखते हैं कि 1 ईयर के बाद पेशेंट का स्टेटोसिस कितना बेटर हो रहा है, उसकी फाइब्रोसिस कितनी बेटर होती है. इट इज अ कंटिन्यूअस प्रोसेस. इट हैज टू बी डन रेगुलरली एज पर एडवाइस ऑफ ट्रीटिंग डॉक्टर्स.
Thank you so much, sir. That was a very enlightening view for all of our viewers. So my next question is that, as you're aware that a lot of ultrasound RF machines, shear wave elastography, and then MR elastography is there. There is no set standards for other imagings like RF and ultrasound. However, still in market, some people practice that, and when they go there with their report to doctors, they feel that they are not standardized. So, what's your opinion for our viewers, doctors, and fellow consultants?
Yeah, if you talk about, there are two, three things. One is ultrasound machine, which is telling us about fatty liver grading, or patient is directly in cirrhosis. So ultrasound machine can't tell us the in-between period of 10 years of fibrosis. Number two, there is one test which is a gold standard in sense, MRPDF, that is MR elastography. Very, very costly, not available in many centers, and not it is cost effective also. So in between there is one technology, that is elastography. So how does it help? It is easily reproducible. If we talk about this particular machine, you don't have to take blood sample. Of course, patient's initial workup has to be done. This can be done on OPD basis. What we need, fasting patient, we can do with any good technician who can be trained within 1 week. And with this technology, we can have on-the-spot method. And this particular machine, we have one probe which is doing 3 works. And with this machine, when the report is, it is an automated generative machine. And in this machine particular, what we have, that is foot switch. It is very easy to use this machine in OPD setups. I think this technology is very, very good. Should be used in vast majority of patients in coming times.
So, according to you, then the target market is not only gastros and hepato. In upcoming years, it will be diabetes, it will be endocrinologists, it will be general practitioners, GPs.
So what I'll take this question in other words, basically in India, it is coming like epidemic. On one side, I want to educate our patients, my viewers, that we should think that obesity per se and fatty liver, it is not a simple disease, it is a deadly disease. So now more and more patients of fatty liver, they're coming with cirrhosis and end-stage liver disease, eventually going for liver transplantation. And if somebody is saying fatty liver, so don't be so relaxed. We have to check what is the fibrosis level. So this machine has wider application, has to be gone beyond gastroenterologists and physicians. At periphery also, even I'll say that with the GP levels, should be in proper setting. It should be validated to all patients in which there is a fatty liver. We should make this technology available in more and more doctors in a right way, so that we can save those patients by detecting them in early stages. Yes.
Thank you, sir. It is very important that other consultants who are not aware about this technology, they can also get aware, and maybe they can prescribe to their fellow consultants who have this machine, and a lot of patients can take benefit of this technology. So as you are aware that we have recently, 5 years is a very short time for any technology. Before this, there was another machine which was only available in Indian market. You are the one of the few users in India who has an experience of using both the machines. So NW Overseas launched FibroTouch in 2017, nearly 5-6 years back. So what's your opinion on this machine as existing user, and as compared to other machines, what is your opinion to your fellow consultants?
Rashid, that is a very valid point. Basically, those both machines they are working on one common platform. That was machine available since last many years. Very costly. So there is no head-to-head comparison between these two machines. But when I use this machine, grossly it is serving the purpose. There are certain advantages. One is reproducibility, single probe doing functions in all patients, and there is a foot stitch available. I don't find there is a too much of difference, but we need to have more and more data. Why this? We need to validate this because I've used both these machines, but it's very difficult to comment the finer details. But if you have proper data, we can analyze what is the difference in results and what are the variable factors rather than the machine factors. That's my take on it.
Thank you so much, sir. Again, my last question is that as existing user, we are very honored to be associated with you. We hope that one day this machine gets popular with the support of consultants like you, sir. Thank you so much.
Thank you, Rachit. Basically, this machine is already more popular because there are certain reasons for making it popular. But we need to have scientific data when we compare these two particular machines, and it is not a very difficult job. You can plan in certain centers head-to-end trial, so
Yes,
that
sir.
if there are certain deficiency, we can come to know.
And recent achievements, sir, you would like to talk about this machine, FDA and all.
That is very good news because there are certain certification which we want for particular technology. CE certification and FDA. So it is fortunate that this machine got those certification that give our morale also, that confidence particular technology. But of course, gold standard to differentiate will be in times to come. Now this machine is used day in day out, so probably soon we'll be having data to exactly compare to these two machines. But overall, technology per se is very good technology and for the betterment of the patient's healthcare. Thank you.
Thank you. Sir, would you like to recommend liver scan machine to your fellow colleagues in their OPD procedures?
I think that acceptance of this technology is very important. Now it is going beyond the chambers of gastroenterologist and hepatologist. This will be needed by the endocrinologist, physicians also, and the practitioners who are working in public healthcare. If this technology is used in right sense, that will make the difference. So we can prevent all those patients who are at present having fatty liver. We can prevent them for having underlying liver disease in future. So this technology is very good, should go to the masses in coming future. Thank you.
Thank you so much, sir.